33 states have medical marijuana programs, and a group is campaigning to make Mississippi the 34th.
Well, WJTV 12's Candace Coleman introduces us to the mother and daughter who are the faces of the Medical Marijuana 2020 initiative.
Harper Grace had her very first seizure at 6 months old. We kept having more of them, and then we did a genetic panel, found out she had the SCN1A genetic mutation.
Indoors, Harper Grace plays like an average 6-year-old, but her outdoor activity is limited, and a 99-degree fever can trigger seizure or even be deadly.
It's a mutation with her sodium channels, so she can't regulate body temperature.
If her name sounds familiar, it's because Harper Grace's law is named after her. The law was signed by Governor Phil Bryant in 2014. It allows for patients with debilitating epilepsy and related conditions to receive medical marijuana treatment high in CBD and low in THC. But they can only receive it from the University of Mississippi Medical Center. And though it's named after her, Harper Grace can't participate in the program.
They have to be like the sickest of the sick who have no other option. And we're fortunate that Harper Grace isn't the sickest of the sick. But like I said, it's any type of seizure is bad. It doesn't matter if it's 3 minutes or 3 hours.
Right now, she takes 4 medications twice a day through a feeding tube. Harper Grace's mom, Ashley, just wants a more natural option. And the Medical Marijuana 2020 initiative is how they plan to get it.
When I go around and speak to groups or we're out gathering signatures, it's usually about 80 to 85% of people are willing to sign. They're excited about it and they understand that it's medicine.
86,000 signatures will get medical marijuana placed on the 2020 Mississippi general election ballot. Filed in July 2018, it's already gained over 20,000 signed supporters. The proposal not only includes the development of medical marijuana treatment centers, but also the ability for patients to use the whole plant, not just the CBD oil.
Parkinson's disease, HIV, AIDS, Huntington's disease. Also, we have included in our initiative, and this is huge, is that people who are addicted to opioids, they would be able to have access to this in place of those opioids, because states that have medical marijuana programs have actually seen a 25% decrease in opioid-related overdoses and deaths.
Now, if the medical marijuana initiative makes it to the 2020 ballot and then passes, the proposal would give the Mississippi Department of Health until August 15, 2021 to get those regulations in place and start issuing business licenses and medical marijuana ID cards. Melanie, Byron.